Okay, so now we'll do the final section here for palliative care. So the definition of palliative care, why is this not advancing? There we go. Any form of care that focuses on decreasing disease symptoms severity for individuals with a life-limiting illness. So basically trying to make them more comfortable, decrease the symptoms, the discomfort, hopefully trying to keep things from getting out of hand and keeping things as contained and as much as possible, keeping things like discomfort from extreme xerostomia and things like that from that escalating to like severe mucositis and that sort of thing. So just trying to keep things or decreasing the symptoms of severe disease. Care does not involve delaying or reversing the disease progress, so it's just sort of accepting the outcomes or the way the disease is going to progress. Palliative oral care, management and prevention of oral problems caused by a disease or treatment of a disease. So like say with cancer treatment. So we're just managing and preventing the oral problems. Focus on patients' immediate quality of life. So bringing in more moisture so their mouth is more comfortable, helping them with keeping the bacteria cleared out so that they have a comfortable feeling in their mouth. They don't have a lot of bad odor or bleeding gums and things like that. So the goals of palliative care: provide relief from symptoms, especially pain. That's one of the biggest ones. Support holistic patient care and enhance the quality of life, just making them as comfortable as they can for as long as they're with us. Offer support to patients to live as actively as possible until death. So just really being a support. Affirm life and neither, I think I misspelled neither, hasten nor postpone death. So it's just, it's taking care of them while they are alive, affirming the life, not thinking about necessarily that death is imminent, but just taking care of them as they live, just with this thought that they'll live forever. But you want to just keep everything as comfortable as possible for the time that they're here. Regard dying as a normal process, so kind of accepting what's happening and focusing on just kind of acknowledging that they have a right to be comfortable, no matter how long they're going to live. And then offer support to the family during the patient's illness and in their own bereavement. So just, again, being a support. So standard palliative oral hygiene care: mouth determined to be overall healthy. If the mouth is determined to be overall healthy, brush all teeth, clean the tongue twice daily, lubricate the lips with water-based gel throughout the day. Take the ability to swallow or spit into consideration. Being careful with things that foam and using suction devices like a suctioning toothbrush. Include denture care, of course, keeping it soaked to keep bacteria from congregating and causing secondary infections like candidiasis, things like that. Utilize a mouth rinse if possible. They may not be able to rinse or just swabbing out. And then palliative care for intubated patients includes a suctioning toothbrush and using a disposable mouth prop so that you can keep the mouth open long enough to clean. Oral complications, oftentimes mucositis is present, ulcerations, the tissue can become very thin and fragile. Common with cancer or radiation therapy. Chemotherapy reduces mitosis rate or the cell division rate, so cells aren't turning over. So sometimes there can be an accumulation or thickening of some tissue, like if the tissue's not sloughing also. Keeping patients' mouth clean and moisturized is key to reducing or preventing mucositis. Rinse with chlorhexidine or topical corticosteroids may also be used. Oral candidiasis, so most common fungal infection, 70 to 80% occurrence in palliative care. So imbalance of the oral flora and the host immunity. Obviously, if they're very sick, their immunity is very low, and we just want to try and keep that balance so that the candidiasis doesn't overgrow. Treated topically or systemically, candida levels can be higher in denture wearers, like I said, so we want to try and soak it in something that kills candida so we don't reintroduce the bacteria or the fungus. And then, of course, xerostomia is a huge one. We should be familiar with this by now. The little note I left there, we're going to see xerostomia a lot. Interview patient and caregivers, find out what they need, what their expectations are, keep tabs on their comfort level and ask questions, perform oral health screenings. Diagnose is ongoing and ever-changing. Every day could be different, especially if they're severely sick and their disease is aggressive. Planning palliative care, maintain oral comfort, hydration, and pain management is really the top priorities. Consult with a palliative care team for feedback and to integrate a plan. So who else is on the healthcare team besides the dental hygienist? Who else is providing palliative care? Talk with them, consult with them. You'll learn a lot. You may teach them something as well, and then implement the care and evaluate the care on a regular basis. And that's it. That was super short. All right.